Purposes, gentleman from Michigan seek recognition.
Mr. Speaker, I would move to suspend the rules and pass H.R. 3204, the Drug Quality and Security Act.
The clerk will report the title of the bill.
H.R. 3204, a bill to amend the Federal Food, Drug, and Cosmetic Act with respect to human drug compounding and drug supply chain security and for other purposes.
Pursuant to the rule, the gentleman from Michigan, Mr. Upton, and the gentleman from California, Mr. Waxman, each will control 20 minutes. The chair recognizes the gentleman from Michigan.
Mr. Speaker, I would ask unanimous.
The gentleman will suspend. The House will come to order.
Mr. Speaker, I would ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous material into the record on the bill.
Without objection.
Mr. Speaker, I yield myself 3 minutes.
The gentleman is recognized for 3 minutes.
Mr. Speaker, I rise today in strong support of H.R. 3204, the Drug Quality and Security Act. I am so proud to say that this piece of legislation is a product of true bipartisan and bicameral work. The Senate and House, Republicans and Democrats, have come together to produce a bill.
The House is not in order. Please take your conversations off the floor. Thank you. The gentleman is recognized.
Thank you, Mr. Speaker. The Senate and the House, Republicans and Democrats, came together to produce a bill that will protect American patients by ensuring that they receive safe drugs. This legislation would strengthen the prescription drug supply chain in order to protect American families against counterfeit drugs. The bill also eliminates and prevents increases in drug prices, avoids additional drug shortages, and eliminates hundreds of millions of dollars worth of duplicative government red tape on American businesses that is harming job growth.
Correct. The House is not in order. Please remove conversations off the floor. Please cease conversations on the floor. Again, please remove all conversations from the floor. Please remove from the aisles all conversation before the gentleman can continue. The gentleman will continue.
Mr. Speaker, the supply chain provisions of the Drug Quality and Security Act are the product of many years of tireless work. We know from stakeholders like Pfizer and Perrigo in Michigan that this is just not a patient safety issue, it's a jobs issue. This bill will bring certainty to the drug supply chain and ensure that patients will continue to receive the medicines that they need without interruption. This bill also addresses drug compounding. This bill is the result of Energy and Commerce Committee's thorough investigation of the NECC meningitis outbreak, which began its devastating spread almost a year ago today. To date, the CDC has linked 64 deaths, nearly 750 cases in 20 states, to contaminated drugs from the NECC. My home state of Michigan has been the hardest hit by the outbreak, with 19 lives needlessly lost, with 3 in my district. And the sad truth is that, yes, they could have been prevented. This legislation is an important step in helping to prevent any such tragedy from ever occurring again. And by reviewing countless documents, holding 4 committee hearings, reviewing various legislative proposals, we better understand what is needed to help prevent a future NECC and built that into this legislation. Mr. Speaker, this bill upholds the current Section 503A of the law and provides with clarity that the FDA needs by eliminating the unconstitutional provisions. The bill also requires the FDA to engage in meaningful communication with state boards of pharmacy. Further, under this bill, entities engaged in sterile drug compounding can voluntarily register with the FDA and operate under FDA regulation. And finally and importantly, this bill protects traditional pharmacy compounding that occurs in community pharmacies across the country. That's why the bill has the support of the National Community Pharmacists Association. I'd like to thank them for working with us so closely. I also want to thank Chairman Pitts, Chairman Murphy, Vice Chair Blackburn, Mr. Latta, and particularly Mr. Griffith for their outstanding leadership on these issues. I want to commend Mr. Waxman, Mr. Pallone, Mr. Dingell, Ms. DeGette, Mr. Green, and Mr. Matheson for their work as well. An additional 1 minute.
The gentleman is recognized for an additional minute.
I also want to thank Chairman Harkin and Senator Alexander for their leadership, and I talked with them a number of times over the last number of weeks. I want to thank our staff on both sides, particularly on our side, Clay Allspaw, Paul Edidell, John Stone, and Carly McWilliams. It is because of their collaborative and tireless efforts that we are near the resolution of last year's deadly outbreak, and their work is to be applauded. To all the families who have lost loved ones and to those who are still suffering today, and I talked to someone whose relative is still suffering just within the last hour, we are near the resolution of last year's deadly outbreak. So let's say to those families and to those who lost loved ones and those who still are suffering today, with this bill, we're going to say never again. So I urge my colleagues to support the bill, and I reserve the balance of my time.